Onc Live Insights is a video editorial program produced by Onc Live.
So I think the use of ferret is going to also evolve with time as well. And so I think that we see some very nice data with Panorama 1 and 2 with combination with bortezomib. But I think there's other very appealing or very interesting pieces of information about how panobinostat can be used. And so the first is the combination of RVD plus panobinostat in the newly diagnosed patient. So we just recently presented some initial data with a combination of RVD or Revlimid, Velcade, Dex, and panobinostat for newly diagnosed patients. And what we see is a very nice improvement in the depth of response. And so very preliminary, we presented at ASH last year, and we'll present some updates this year, but we see a near doubling in the complete response rate compared to historical controls. So historically, we will get a CR rate with RVD after 4 cycles of therapy of approximately 15 to 20%. And with this combination in the ongoing clinical trial, we're seeing almost a near doubling in the complete remission rate to 40 to 50%. This, in fact, is very similar to what we see with the Panorama 1 trial, where we see a doubling in the complete remission rate with the combination of Velcade and panobinostat. And we've seen now that improvements in the depth of response do translate out to improvements in long-term outcome. So I think that's critical now that we're seeing this kind of consistent story with panobinostat, that when we add it with different partner drugs, be it Velcade in the Panorama 1 study or RVD in this newly diagnosed setting, that we're seeing these depths of response. Again, it's a very consistent story showing really how panobinostat can really improve all of our current therapeutics.
Combining a HDAC inhibitor with an IMiD would be based on preclinical data, which actually suggests that there's a reasonable level of synergy. There has also now been a number of early phase trials undertaken looking at the combination of HDAC inhibition with IMiDs. They've proven to be quite tolerable and highly effective. So I think as we gain more access to HDAC inhibitors in the therapeutic context, various combinations with different IMiDs are going to be explored to try and define which is the best approach. But I certainly don't think that we should limit the use of HDAC inhibitors to combination with proteasome inhibitors, as there's evidence, of course, as I've said, that they synergize with a range of agents, including IMiDs. So we need to exploit that potential by looking at all different combinations.